Welcome to This Week in Health IT News, where we look at as many stories as we can in 20 minutes or less that's going to impact health IT. It's Tuesday News Day, and we're reporting again from the outside, the wonderful outdoors, taking my own advice and getting out and enjoying the sun while it's out here. So it's Tuesday News Day, and here's what we have on tap. CommonSpirit names a new Chief Information and Digital Officer, which is important for a couple of reasons, and we'll go into that. UPMC Carnegie Mellon to use Amazon AI tools. We'll talk about that interesting dynamic which is going on across healthcare. Let's see. Report most health systems still lack a long-term digital strategy. I think that's an interesting story, and we'll talk about why that's happening and why that's important. And best jobs in America pay more than $100,000 is a Barron's article, and the cool thing is a bunch of those are in health IT, so that's why it's relevant. That's why we're going to talk about it. My name is Bill Russell. We're covering healthcare CIO and creator of This Week in Health IT. I've set up podcasts and videos dedicated to developing the next generation of health leaders. This podcast is sponsored by Health Lyrics. Professional athletes have coaches for every aspect of their life to improve performance, which makes sense, yet many CIOs and health executives choose to go it alone. Technology has taken center stage. Get a coach in your corner. Contact Health Lyrics to schedule your free consultation. If you want to support the fastest growing podcast in the health IT space, here's 5 easy ways you can do it. Share it with a peer. Follow our social accounts, LinkedIn, Twitter, YouTube. Interact and repost our social media content. Send me feedback, Bill at thisweekinhealthit.com, which has been phenomenal. You guys have been telling me what's working and what's not working in this news show, and I appreciate it, so we keep adjusting. And subscribe to our newsletter and other services on the website. So speaking of other services, we launched 2 services over the last 3 weeks. We launched Insights and Staff Meeting. Insights is for those of you who are looking to develop your career and to catapult your career forward. You can sign up for that, get 2 videos a week that will help you with your career. And Staff Meeting is for managers who want to get their staff meeting off on the right foot, introduce your team to some new thinking, and get a conversation started. So we launched those 2 services. If you're interested in either of those, hit the website, subscribe, and you should be off to the races. Let's get to the news. So CommonSpirit names a Chief Information and Digital Officer. CommonSpirit, if you don't know, is the combined entity of Catholic Health Initiatives and Dignity Health. They combine their $29 billion nonprofit Catholic health system operating in 21 states. And they have named Suja Chandrasekaran, formerly with Kimberly Clark, as their first Senior Vice President, Chief Information and Digital Officer. I think it's important for a couple of reasons. One is Suja is a woman, and that is phenomenal to continue to have women move forward in health IT careers, which is exciting. I think the other thing that is really exciting is the combination of these 2 roles. I'm a firm believer that these 2 roles either need to be so closely linked that the 2 people would have to share a brain and really be on the same page. Or the second thing is it could just be the same person. And so I think it's exciting that you're seeing this happen. I think it's happening for 2 reasons. One is Chief Information Officers want to have the ability to impact the consumer experience with digital tools. And so the Chief Digital Officer has been making inroads into healthcare, and CIOs see that as an area where they can really have an impact. I think the other thing is you're seeing Chief Digital Officers say, you know what, I need to have a little bit more control of the platforms and the data and how things move around the system in order to be effective in the role of Chief Digital Officer. And I think either having them all in the same organization or having them be the same person is a really cool way to do that. So you're seeing that happen more and more. You're also seeing healthcare go outside, and we covered that. I think we even covered it last week. We covered it because we talked about the Kaiser. So they cite in this story, Kaiser hired Prat Femena from the Home Depot as their new Chief Digital Officer, and we talked about that person. We talked about Aaron Martin, who came from Amazon, who's at Providence. They note in this article Eduardo Conrado, Chief Digital Officer for Ascension, who came from Motorola, and there are several others that are out there, and that trend continues. And I think it's a good trend. I mean, there are a whole bunch of things that we can learn from other industries around using digital tools to create experience, to reduce friction, to improve the convenience factor for healthcare. So one of Suja's big tasks will be to create interoperability between the technology capabilities of the formerly independent health systems. The health systems said she would redesign business processes with technology and operating models that connect the 150,000 employees and 25,000 physicians across the different geographies and communities of CommonSpirit Health, in addition to designing digital capabilities to transform the patient experience. She will seek to lead the integration and modernization of technology systems to connect the health system's 142 hospitals and more than 700 care sites. So wish Suja the best of luck. Just reading that off, you can imagine that this role is a pretty high-level role, that you're going to see CommonSpirit hiring key people just underneath Suja to handle certain things like cloud infrastructure, data analytics, the development of platforms and APIs. All those things have to be put in place. And quite frankly, knowing what I know of these two health systems, there's an awful lot of EMRs in play. There's an awful lot of technologies in play. There's probably thousands of individual apps in play and data silos. So there's an awful lot of work. I'd love to see them go greenfield on a lot of this stuff and just rethink and redesign the whole platform. I've talked about this too much, but it's exciting story. Glad they're doing this. Next story, UPMC Carnegie Mellon to use Amazon AI tools. So UPMC and other prominent Pittsburgh research organizations announced Wednesday that they plan to leverage Amazon division's machine learning capabilities to accelerate breakthroughs in patient care and product commercialization. Amazon Web Services will share its machine learning, a type of AI, and cloud computing resources with Pittsburgh Health Data Alliance, a big data consortium formed in 2015 that includes UPMC, University of Pittsburgh, and Carnegie Mellon University. I mentioned this, not to really go in depth in this, because we've talked about this a bunch, and we will talk about it more in the future. I mentioned this because it's almost become like signing day. You know, in like college football, when the high school students announce what college they're going to, that's almost what's going on here. If you watch this closely, as I am, you're seeing Amazon sign up different entities. You're seeing Google sign up different entities. You're seeing Microsoft sign up different entities. And a lot of it is because people have got to decide where they're going to start and what platform they're going to start on. I think some of these entities try to do it themselves and have realized that the capabilities that these cloud providers are bringing are far superior and far advanced as to what they were able to build out themselves. And now it's signing day. And it's kind of funny. I'm almost thinking of doing a segment called Signing Day and talking about who signed with whom as you start to see this thing roll forward. I saw Providence sign with Microsoft. You saw Halamka and Beth Israel Deaconess do some stuff. I think it was with Amazon as well. So you're seeing Amazon make some inroads. You're seeing some people sign with Apple and with Google and other things. So it's interesting. Signing day. So there you go. UPMC is signed with Amazon. I don't think that locks them in. I think it's a starting point. I think there's going to be things that Amazon's capabilities are going to be good at, and there's going to be things that Google's capabilities and so forth and so on. So you might see some of these entities sign with multiple players. We'll see what happens. All right, let's move on to our next story. Our next story is a report. Most health systems still lack a long-term digital strategy. This comes to us from Rajiv Leventhal, who we've tapped on a couple of stories, actually. Healthcare, he comes from Healthcare Innovation Group. Let me read a couple things from this. The survey of CIOs and other executives examined digital health maturation and how patient care organizations are strategizing for the future. Healthcare's digital transformation is still in the early stages of maturity relative to other sectors, but CIOs do understand the imperative to drive digitization. Comes from a new report from the advisory firm Damo Consulting, which is Patty's company. We'll get to that in a minute. Let's see. According to researchers, there's 4 models. So let me give you the 4 models real quick. They are a reliance on the EHR systems to drive digital engagement. That's model number 1. Model number 2 is digital strategy singularly focused on virtualization of care. The third model is a standalone digital initiative driven by internal demand. And the fourth model is strategic investments in long-term digital health platforms. And he goes on to say most health systems, especially smaller and mid-tier ones, operate in models 1 and 2, and only the nation's largest health systems are operating in model 4. The majority of CIOs in the focus group, however, acknowledge that all enterprises need to shift to model 4. The findings revealed. And Patty, in my discussions with health system CIOs, what emerged was is that not only are most health systems in the early stages of adoption, but there is no clear consensus on what digital transformation looks like and how to achieve it, said Patty Padmanabhan, CEO of Demo Consulting. Most health systems consider their EHR systems as their digital strategy and are developing standalone solutions on an as-needed basis without long-term digital strategy in mind. All right, so before I go on here, there's just a wealth of stuff right there. These 4 models, I found it to be true. The more health systems I talk to, you do have a fair number of people who rely very heavily on their EHR and are focused on their care model. So what you see there is health systems that are saying, let's reduce clicks, let's focus in on the patient, or on not the patient experience, on the physician experience, the clinician experience. Let's automate processes internally. They may be looking at new technologies, but typically those come through either the EHR provider or close partners with the EHR provider. They might even be doing AI, machine learning, Internet of Things, and some really interesting things. There are a lot of things you can do in a Model 1 and 2. I think the point of this article is that it's sort of like, hey, what's the next thing coming from my EMR? There's no long-term vision and strategy for it. I think what you're seeing in the Model 3 and 4 care providers, especially the Model 4 care providers who are making strategic investments in health platforms, is first of all the word platforms. They are looking at it as, how am I going to be able to deliver an experience? How am I going to be able to deliver to extend my care and the services that I offer across digital platforms to the communities? I think that's one aspect. I think the other aspect is they've taken the time to think through the people who live in their catchment area, the people who live in their communities. They've taken the time to talk to them, to understand what they're looking for from a health system, what their goals and what they're trying to achieve, and then they start to organize their investments around that. If you spend any time at all in those kind of innovation models, incubators, and even VCs and private equity that floats around healthcare within health systems. So I'm still talking about health systems that have those models. They have spent an awful lot of time saying, what is the next thing? How are we going to extend this? What is the new model for care? They are looking at what healthcare will probably be in 3 to 5 years, not what it is today, and trying to fine tune it. They do that as well, but they really do try to come up with new models for care and new models for reaching those people. So you're seeing them. I think one of the key differences is an internal focus in models 1 and 2, and really an external focus in models 3 and 4. That's not always the case. A lot of times you'll see Model 3 players. When I talk to Model 3 players, a lot of times what I get is, hey, we're starting to do telehealth. And telehealth is strategic, and it is a way of, it is probably the first way of moving your ability to deliver care outside of your health system effectively is through telehealth. But there's an awful lot of other digital tools for engagement, to keep people healthy, to reduce friction, to provide convenience. All right, so let's go on. The article goes on to say health system CIOs in the focus group who are developing patient engagement applications expressed that they are actively looking at monetizing the capabilities by offering them to peer systems that are yet to make the investments. The only thing I will say to people who are making that statement is validate your market before you make that assumption. I've talked to too many CIOs who are like, hey, we're creating this really cool thing, and I'm sitting there going, I know 15 other companies that are doing that today. So you might want to validate that or have a market already in mind, because sometimes we're developing a new portal and we're going to take it out there. There could be a ton of people already doing that. So you still have to, even if you're doing it within a health system, you still have to do that initial work to validate your market and to validate your assumptions, to make sure that there's something after you've spent all the money to develop it. According to Padmanabhan, it also comes Oh, he's talking about CDO roles, and he says it comes down to whether a health system can afford to have another executive. And what they found is that the smaller health systems do not have a chief digital officer, and that work resides within the chief information officer title. I don't think that's the worst thing, as we've talked about earlier. I don't think that's the worst thing in the world. I think that's fine. What I would encourage the smaller health systems to do is to rely on organizations like Avia, who has an awful lot of digital strategy work that's going on that they can provide to you. The advisory board used to do that, but I think Avia is a much better organization today for that. Don't shoot the messenger at this point. So they do a lot of stuff there. I would say hit your existing vendors today, and look to partner with those innovation groups. You have them at Dignity, you have it at Providence, you have it at Cedars, you have it at UPMC, you have it at fill in the blank. There's Vanderbilt, and they're all over. And find the ones that are closest to you. I think you'll see Atrium start to do the same thing. Find the ones that are closest to you that are investing in innovation, and see if you can't partner with them and leverage off what they're doing. If you don't have the capital to invest, just partner. It's a great way to go. Let's talk about the best jobs in America that pay more than $100,000, which have a high number of openings. So Barron's did this article. Companies are always keen to use Intel to improve efficiency, to learn more about their customers. And so data scientists are in high demand. They are the number one on Glassdoor's Best Jobs in America for 2019, for the fourth straight year, by the way. They boast a median annual salary of $108,000 a year, but Glassdoor also says that there are signs that the salary growth has been leveling off. They were followed by nursing managers at number 2, and marketing managers at number 3, and occupational therapists at number 4, and product managers at number 5. So the Glassdoor job score is determined by weighing 3 factors equally: earning potential, median annual salary, base salary, overall job satisfaction rating, and number of job openings. For a job title to be considered, it must have received at least 100 salary reports and at least 100 job satisfaction ratings. Let's read one more thing and then I'll comment on it. There were other six-figure jobs among Glassdoor's top 20 list with relatively high number of job openings. And that criteria at number 6 was DevOps engineer, who work with developers and IT staff to oversee code releases. Data engineers at number 8, software engineers at number 10, physician assistant at number 12, strategy manager at number 16, and security engineers at number 17. I'm surprised that one's only number 17. I have a feeling with the number of openings and the scarcity of resources of really good security engineers, I would think that number is going to go up in the coming years. So, here's my comment on this. There's a lot of great jobs within health IT and a lot of opportunity for growth. I think a lot of them are going to come in data analytics, development, and design. Product managers, I think, is an interesting title. I think we're going to see a move towards more of an IT shop that has a lot more product managers as opposed to analysts. I think people are going to insert those product managers who own a product for the duration and the life of the think of it as an application. I would have a product manager for Epic. I would have a product manager for fill in the blank. This is really common within Silicon Valley, and those people are constantly working with the end user community to understand what the requirements are, what the demands are, and what they can do with the product, and then working on the development side to make those things into a reality. So these are some interesting titles, a lot of really good opportunities. I know that with mergers and acquisitions, people are worried about, am I going to be able to keep my role? And the answer is, who knows? I mean, there's so much merger and acquisition activity going on, but I don't think that means there's going to be fewer jobs in health IT. I think there's going to be more jobs in health IT. I just think they're going to change. They're going to change a little bit every year, and eventually you're going to have an awful lot of people on the data side and on the application side once we get through this automation stuff we're doing today. I think you're going to see the infrastructure get automated. I think you're going to see the acquisition of data get automated, and I think it's going to be a matter of creating new applications around the capabilities that we've created. So let's see. Well, that's all for this week. I had some other interesting stories to talk about. As always, I have about 10 stories lined up here. We'll save some of them for next week, and we'll get to them. So that's all. Every Friday, check out our interviews and with industry influencers. Keep the comments coming. Love it. Bill at thisweekinhealthit.com. Good, bad, or indifferent. It all helps. This show is a production of This Week in Health IT. For more great content, you can check out our website, thisweekhealth.com, or the YouTube channel, thisweekhealth.com/video will get you there. Thanks for listening. That's all for now.